Welcome. I'm Catherine Cashman, and I am owner of Cashman Center and a psychologist for many years in the South Metro area. And it's so good to have all of you here. I'm just going to make a few opening remarks before we get started. I want to thank Jerry for the beautiful piano playing. Thank you. Live well with cancer? You may not believe that is possible. As a 2-time cancer survivor, I know that it is possible to live well with cancer. I want to share with you hope and encouragement that you can too. That is why I began the Living Well with Cancer program at Cashman Center. Our program exists to support you to live well with cancer. At Cashman Center, living well with cancer means managing physical symptoms and or emotional pain, being able to enjoy activities with our children and grandchildren, appreciating the beautiful fall leaves, uncertain of the future yet grateful, comfort in knowing you are sharing your journey with others who have cancer, helping you to find and connect with the resources you need to help you live well with cancer. At Cashman Center, you will experience being cared for as a whole person by providers who understand that cancer is affecting all aspects of your life. Living well with cancer is more than just surviving. It's about living a whole life, embracing love, family, and faith. The Living Well with Cancer program is a program within Cashman Center. Cashman Center is a holistic mental health center. You can find information about us on the resource table in the back and online. Cashman Center staff are in beautiful blue golf shirts. Haha, I was rageful when I got up this morning putting this on. And then I turned grateful quickly, and are available to answer any questions you have. So thank you for being a part of tonight's conversation.
Good evening. I am Kelly Hegel, and I am the Community Outreach Director for the Cashman Center. And unfortunately, I had not heard of the Cashman Center until about 4 months ago. And now I work for them, but only for the last couple months. My cancer journey began 4 years ago when my husband was diagnosed with neuroendocrine cancer and was given 6 months to 2 years to live. He passed away 10 and a half months later at the age of 44. Our children were 7 and 10 at the time and are now 10 and 13. And I wish I had known about the Cashman Center at that time. I wish I had known of the alternative therapies available that could have possibly helped alleviate some of the extreme pain he was in as a result of his liver being covered with tumors. I also wish I would have known of it even in the last 3 years to help my son manage his symptoms of depression and anxiety as a result of losing his dad. My goal is to inform and educate people of the other possibilities and alternative therapies and options that are out there so that can help you better heal through this journey. Thank you.
Good evening. My name is Jim Marshall. I'm currently serving as coordinator of pastoral care ministries and justice and service ministries at All Saints Catholic Church in Lakeville. I also served there as deacon. I was ordained a deacon for the Archdiocese of St. Paul and Minneapolis in 1999. My wife Jenny and I have lived in Lakeville for about 30 years. We have 2 daughters who are 27 and 24. I know I don't look that old, but I am. My role here this evening is to kind of be a voice of the faith community, and how the faith community can be a resource and a support to people who are dealing with a cancer diagnosis, to their loved ones, their family, and to anybody in need. I've had, I'm going to call it the opportunity because it has had its blessings, the opportunity of being a part of the journey for a lot of people who've battled cancer. Most recently and most closely, my brother-in-law, 43 years old, was diagnosed in September of 2013 with stage 4 metastatic melanoma, and he passed away this past February. My sister and their 3 kids, who are now 16, 14, and 11, are on that journey with a lot of very strong support around them. So it's both, for me, both touches home professionally, but also very much personally. Thank you.
Good evening. My name is Barb Sable. I am a wife, a mother, a cancer survivor, an oncology nurse, and a parish nurse. I worked with Deacon Jim at All Saints for about 5 years, actively in parish nursing, and I'm consulted by him when circumstances arise and help whenever I can with my healthcare background. I do go and visit folks in their homes as part of parish nursing ministry, but also now as a Eucharistic caregiver for the church. I hope that I can answer any questions you may have about faith community nursing and where you might be able to find your resources in that, and any questions you may have about the inpatient environment. I currently work at the University of Minnesota on the surgical oncology unit. Thanks.
Hi, my name is Heidi Mogish. I am the voice of the patient on this panel. 5 years ago, when I was just 32, I was diagnosed with breast cancer. I had a 1-year-old baby and a 4-year-old son as well. And we treated it with surgery and chemotherapy, and I was blessed to also ask the right questions and know the right people that could help me also use healing touch and acupuncture to really thrive through my cancer treatment. I would say cancer broke my heart, and cancer also helped it to heal. Having such wonderful support and kind of all the right things at the right time have helped me be more of who I am now, and more than I ever could have been without it. So I'm here to help those of you dealing with cancer know that you can have that too.
Hello, hello, hello. I already broke the rule. Don't get near the speakers. Hi, my name is Janice Shortle. I'm a reporter for KARE 11 News, and I am here just to be your moderator. Not here to get in the way. I'm here to take all the index cards with questions, make sure that goes fluidly, because that's the second job of a news reporter, is to act as these types of things, right? Because all of these people have all of the information. So it's an honor to be here tonight. I've only recently become knowledgeable about the Cashman Center, and when I became knowledgeable about it, I wanted to be a part of tonight's events because I think the work that they do is really beautiful, and I think it's really important, and the more people that know about it, the more people can utilize it. So it's an honor for me to be here tonight, and my first line of duty is to introduce our keynote speaker, Dr. Gregory Plotnikoff. In your program, you can read all of the things he's really good at and why he's qualified to be here. I asked him if I could not read that because some of those words were big, and I asked if I could just introduce him the way he would like to be introduced, so he promises to be a provocative speaker tonight. I don't think that that's anything that you can't tell your children about. He wants to entertain you and inform you and be helpful to you, answer any questions that you may have. Nothing's really outside the box. We're just having a conversation here. There just happens to be microphones. So ask what you want to ask. That's why we're here. So Dr. Plotnikoff.